Hi, everybody. I'm rocking out to some Olivia Newton-John there. This is Melanie Chavarker, nurse practitioner. And this song was just coming on, and I was kind of laughing because we're going to talk about, oh, there she is. We're going to talk about physical therapy. So let me have my dear friend Janet, Dr. Janet, join. Give me a minute to turn off the music here, the fun music. Let's get physical therapy. Let's view this request. And Janet, let's go. Come on, Janet, join us. There she is. Yay!
Hi! I love the music.
Let's get physical therapy, right?
That is awesome.
So I know we're on my Instagram live, but I'm sure followers from your channel are joining. And I'm Melanie Chavarker, nurse practitioner. I specialize in integrative and functional medicine for women. And here with me today is my new friend who I totally love, Dr. Janet Yu. She is a doctor of physical therapy and specializing in pelvic floor therapy. And I just have to say, I love pelvic floor therapists. I have used a pelvic floor therapist after my second child. I wish it was Janet because I think Janet is amazing. And luckily that was 14 years ago and I don't need physical pelvic floor. Well, I may, who knows, but all of us could probably use pelvic floor therapy. But she and I decided to do this Instagram live and hopefully help each other's, clients kind of find the right resources. And, oh, are you there still? I think I'm there. Hey, Janet, you're frozen on my end. Hopefully it's not me. Hi, everybody. Hopefully we didn't freeze. I'm going to keep going. Janet, join in when you're there. Hopefully it's not my internet. I'm still on. Okay. You're frozen on my end, but good. That's not good, though, because I can't tell if you're there. Let me see if it's my computer and my internet. We may restart if I can't get going here. Let's see. You're good. I'm going on and off and coming on again. Okay. All right. So she's going to go off and come on again. I think I'm still live. And if you are having trouble hearing me or I'm not live or something going on, shout out to me and let me know what's going on. Okay. So we're going to bring her on. Let's see if this works. We may have to restart this. Oh, there you are. Okay.
Hi, I'm back again. I don't know. It booted me off and I was able to see you and hear you.
Okay.
And,
So we're still live, everybody. If you can't hear us, something's going on, message us.
Yeah.
We did have a lot of viewers popping on and hopefully they're still there with us. But we're talking about physical therapy and we're talking about conditions that I treat and what we would each do for each of these conditions, specifically pelvic pain. So I think we had a big list. I don't know. Let's see what we can talk about. Even a quick overview of what we do in these different conditions. We were going to talk about fibroids, periods, and
endo.
And endo.
Yes.
Oh my gosh, endo's huge. Yeah. So why don't you talk a little bit? I've been doing a little bit of talking. Why don't you talk?
No. Do you want me to start talking about maybe endo?
Yeah. Let's talk about endo.
Well. So that's one of the things I do commonly treat, and it seems like it's, of course, as we both know, it's really hard to get that first diagnosis.
Yeah.
And for me, what I often see is typically the person that's coming to see me has only been given birth control as a way to regulate their pain during their cycle, and maybe they've had excision surgery but haven't had PT yet. So yeah, so with endometriosis, what we can do as pelvic floor physical therapists is to go in and help to reduce any pain that's coming from tight muscles of the pelvic floor to guard and protect that area, right? Because there's these lesions that are in and around the uterus, intestines, whatever else, bladder, And the muscles, they do their job by protecting these organs, and they fire up. And so what pelvic floor therapists can do is we can work on these muscles to help kind of calm them back down. And then that goes into, when they are calm, then there's better blood flow to the area, and that can promote healing.
Right.
So I work on what's visceral mobilization, so being able to move the organs a little bit. Sometimes when there's lesions on the organs, what happens is the organs lose their ability to move, and that can lead to, various things. So helping to restore some of that movement that the organ should have to function, in that container in our abdomen, to just kind of move a little bit. Because when it's stagnant, those organs are not happy. So that's one other way pelvic floor physical therapy can help. And as a result of that, if people are having painful intercourse, that is something that we can help with, painful intercourse when you have endometriosis, because a lot of these things that I just mentioned, the guarded muscles, the organ protection response, can lead to pain during intercourse and just generalized pelvic pain. Yeah.
Yeah, I think that's awesome. Like, I'm just sitting here thinking about, wow, what can, nobody really thinks of physical therapy for endometriosis, but you just explained all the different ways that we can improve blood flow, movement, really get things, changing in a different way, because, we always think of things chemically and we don't think of things energetically or physically. And I think that's kind of that holistic approach. On my end for endometriosis, I am thinking about things chemically. I'm thinking about inflammation. How do we reduce inflammation? So I'm giving a lot of herbs to reduce inflammation, because it's not just a pelvic or abdominal situation. It's really an inflammatory condition that could be affecting the whole body. I'm also thinking about fertility. How can I improve fertility for these folks? They typically have very high estrogen levels, which is contributing to endometriosis. So, in my head, I'm thinking, okay, what can I do to bring that down a little bit and balance those hormones with the progesterone and the testosterone also at play? So that's kind of in my head how I'm approaching endometriosis to kind of help with those situations. And pain, how can we kind of help with it? Pain comes with inflammation. So if I can reduce inflammation, I'm reducing pain. So we don't want to necessarily put people into menopause, which is what a lot of the hormonal contraceptions do, not the contraception, the hormonal treatments, the GnRH agonists, antagonists, those have a lot of kind of shut down that system, versus birth control is kind of giving you an alternative contraception. It's synthetic contraception, which is a hormone, which is kind of suppressing your own hormones, but that's not really great for fertility as well. So trying to kind of come up with natural herbs and supplements that could kind of ease that balance. So that's kind of how I'm thinking from a functional perspective. So what a great double approach we would have, right, for endometriosis.
I love sending my people out who have endometriosis to make sure that their hormones are balanced, because I know that if they're not, then it just keeps feeding into that cycle.
Exactly. Cycle. That's the key, is like there's this inflammatory cycle that we have to kind of shut down. And I can imagine by the work you're doing, you're kind of doing it from your perspective, and then I'm doing it from my perspective. So we're really kind of hitting it from all different angles, which is really the kind of treatment you need for endometriosis, because it's really a tough condition to treat. And there isn't a lot of great solutions out there. Laparoscopy is cleaning it out, but then you often see it come back after laparoscopic intervention. And, those hormones that I was talking about, all those different hormones kind of shut the system down, versus really, which is not great, because a lot of the endometriosis patients are coming to us because they also want to get pregnant, so that's kind of,
and endometriosis can be found anywhere. I just wanted to put that out, right? Like they found this all over the place. A PT that I learned from, she had mentioned that in some individual, they found it in the brain, endometrial cells, and so so that is not even
why we don't always know exactly. We still, in modern medicine, don't have really good idea of why this is happening. I think that when we get to that root cause, why, we understand it's an inflammatory condition, we understand, but we still don't even know why this is happening to people.
Exactly.
So I think there's some interesting theories out there, but yeah, I think kind of working with what we get and then trying to kind of hit that root cause and try to provide some changes can kind of change the conversation for a lot of people with endometriosis. Yeah. Hi, everybody. Wow, we've got lots of people joining us. Thank you. Thanks for joining us. In case you've just joined, I'm Millen Chavarkar, nurse practitioner, and we have Janet Yu, Dr. Janet Yu, and she's a doctor of physical therapy. So we are here talking about different conditions and sort of our approach and how, this is a more holistic approach when we kind of combine functional medicine, integrative medicine with PT. So,
even with my approach, I have to say that I treat with the premise that like organs and central nervous system are the supreme.
Right.
So I work on calming those things down first, and then getting down to the organ. And then after that, it's pelvic muscles versus just solely focusing on the pelvic floor. Because it is really important to make sure that our central nervous system is in a good state to receive treatments, and that the organs themselves, whether it is the actual uterus or any other organ around, is in a protective response so that it doesn't want any other treatment on it.
Totally cool. That's what I love about the way you approach it, which is so different than I think other PTs that I've talked to. Like, you really understand that sympathetic, parasympathetic, how important that is in doing treatments, and that's very integrative. That's an integrative approach. So so I don't see any questions. If you guys have any questions, throw them into the comments, we can answer those. We kind of covered, obviously our treatments are very complex, but we did it in 5 minutes. We talked about endometriosis and our approach, just to give you guys a hint on how we would, approach these things from our perspective and what we do in our practice. I think next, what do you want to talk about next? We're going to talk about
fibroids.
Let's talk about fibroids. Tell me where your approach to fibroids.
Our approach, it's very similar to endo in the sense of just like really looking at any protective response that the musculature has to the fibroids in the uterus. That when there are fibroids in and around the uterus, that the muscles sense that and wants to guard that tissue. So what are things that, as a pelvic floor therapist, what can we do to help calm down the uterus itself? And then also going back and working on the musculature to help relax the muscles, keep them calm, multiple different ways to do that. And then from that point, again, because we're helping the muscles get calm, there's more blood flow, and it just improves the healing in that area. A lot of people do have like the other things like low back pain, maybe hip pain that's associated with the fibroids as well. And some of those I think are actually referred pain patterns from the uterus. So calming that down and providing the uterus its mobility, its motility, mobility back. It should move a little bit. If there is some issues with the uterus not moving well, that can definitely pull on the back, the tailbone, the SI joint, and your pelvic bone, causing various pains in and around the area. So being able to restore that so that that calms down, and then going in after the musculature and making sure that that is calm as well.
So much pain people have in fibroids, right? And you were talking about all those areas that are, because there's ligaments from there's tissues that connect the fibroids to all these other structures, the uterus to all these other structures. And so of course, if the uterus is enlarged, then those are all getting pulled and pushed and, kind of out of place. And then all the organ displacement that comes from having a fibroid, a very large fibroid, can really cause a lot of discomfort because of that displacement and the space it's taking up. And that's where
show the pelvic floor.
I think that'd be lovely. So, I need one of those too. I just went to a talk this weekend and I was like, how come I don't have the pelvic floor?
It's upside down.
I gotta buy one.
I need to fix the rectum, but essentially that's what the
Yeah.
organs look like internally, right? The rectum should be back there. I need to like push it back in, but that's your bladder, that's your uterus, all right, fallopian tube, ovaries, rectum. And what's not shown in these hard models is the fact that there's this ligament that essentially attaches these three structures front to back and all across. And so if this uterus here is enlarged due to a fibroid, it can pull on these ligaments that are attached to your sacrum, your pelvic bone, and that can cause pain. And at the same time, because of all the other organs that are in there, that can cause bowel and bladder dysfunction as well.
Yeah.
So that we can work on making sure that the uterus can move in its space, and just being able to glide between the rectum and the bladder. It should move a little bit, not a lot, a little bit, so that it has that mobility again. And then also making sure that the ligaments are in as good of a position as they can be to reduce the pain that is on these structures.
Yeah. That's so cool. Gosh, I think if I did it over again, I think I'd be a physical therapist. I love it.
Yeah.
We
Super
do a
fun.
little
Come
bit
on
of
over.
midwifery.
Yeah.
We do a little bit of midwifery when I train, but yeah,
Yeah.
you know, that's why we have you. But I think from fibroids, again, from my perspective, very similar to endo, like you, I'm looking at hormonal balance. You know, I have had a patient who had what we would call a 20-week fibroid, or basically a fibroid to the belly button. And within 3 months, it shrunk to her pubic bone.
Oh, wow.
And that was done just by, we did a detox. We worked on food and diet and lifestyle. And then I gave her some very good GI support, because the GI system is integral to our hormones.
Yeah.
And there's some recycling of hormones that occurs through the GI system. So we actually gave something called beta-glucuronidase, something to affect the beta-glucuronidase enzyme, which is in the bowel, which actually recycles your hormones. And so we figured out that was abnormal for her. And by giving her some D-glucarate, we were able to kind of stop that processing. And so her fibroid shrunk. So that was a really fascinating, wonderful case for me, because I realized, you know, typically, well, what are we doing in conventional medicine for fibroid surgery? We're getting rid of the fibroid. We're giving hysterectomies. And this woman came to me saying, hey, you know what? I really don't want surgery. I really want to see if I can do this naturally. And I said, well, theoretically, we should be able to. Let's do it. And it worked. So I think that was a really specific case of what was going on. So we hormonally balanced. She was, you know, she had an excessive amount of estrogen, so we balanced that out. And that case, she was really happy. So
that's why I love sending people who have fibroids and endo to people like you, because that hormonal piece, I think, is so important in, you know, kind of feeling better, getting it all balanced out. You know, making sure that you have tapped out of all the things you can do before having any type of surgery. Yeah.
And that was her theory. Like, let me go see this integrative functional person and let's see if we could do something. And it did. It worked. You know, I'm sure I was really shocked, honestly, because I had never done that in functional medicine. That was my first case. And, you know, had been treating fibroids for 20 years by a referral to the OB/GYN for surgery. So, you know, or we do sometimes give hormones to kind of, again, like endometriosis, kind of dampen down the estrogen. But fibroids is also interestingly linked to glucose intolerance. And so addressing glucose intolerance can also help, because it's something to do with the way insulin's interfacing with insulin sensitivity, and insulin is interfacing with hormones, which it does. So that's kind of how my approach was to the fibroids. And so again, like, this would be, you know, a great combination of treatment for people who have fibroids. So if you're suffering from fibroids, for sure, you know, reach out to us so that we can help you in a holistic way. So,
and I know it's something a little different that we're not as talking about today, but PCOS, that's got an insulin relationship as well too. So yeah, I'm not surprised that with fibroids that it's got some relationship to glucose and insulin
Yeah.
and insulin intolerance, because it plays such a big role
Yeah.
in hormones.
Yeah. And look, if we can avoid somebody from having surgery, think about all the things that you probably have to take care of after
Yeah.
surgery, right? With bowel, bladder
Mm-hmm.
issues after surgery. So if we can do something more naturally, then we're avoiding those issues. And I know, like someone very dear to me, well, I don't know. My mom had a hysterectomy
Yeah.
after fibroid, very large fibroid, and I know what that was for her. So I, just feel so glad that I can help other people with fibroids and
Yeah.
maybe approaching it naturally, because who wants to get surgery if you can avoid it? So, and I think it's something that's not talked about a lot is how can we, what other factors? Again, it's all down to root cause. What is the root cause of something, and can we address that instead of masking the symptoms, which is what we tend to do in conventional medicine? So I love the physical energetic approach to somebody who has fibroids. What can we do to relieve their pain naturally, by doing PT and doing these maneuvers? And then also, can we kind of just get rid of the fibroid, by doing improving blood flow and then doing some hormonal balancing? So yeah.
Excellent. And, in regards to surgery, a lot of people don't realize that it might be seemingly like an easy surgery, right? To just go in there, get it out. But at the same time, anytime you cut into your body, especially the peritoneum, where it contains all these other organs, it might, when you have a cut into that peritoneum, it can affect all the other organs. So
yeah, and on top of that, like there's always something that could possibly happen on the side. A good friend of mine just had a hysterectomy for fibroids and endo and did the robotic surgery, and now she has an umbilical hernia. And she's so bummed because she just went through this really intense surgery for fibroids and endometriosis and thought, okay, I'm going to feel a lot better. And, she's in menopause, so it wasn't, she was like, okay, I really don't need, my uterus. I'm not going to have any kids. Maybe this is my, and I do think it was a really good decision on her part. She had been suffering for a long time, but surgery doesn't come without a cost, and here she's got this, now she's got to go in for another surgery and she's so bummed. And I thought, unfortunately, we think we're going in for something easy and you just never know. So I think, wow, we've got so many people joining us. Thank you so much for joining us. And you can always look at the recording if you missed out. We just talked about endometriosis and sort of a functional medicine approach and a physical therapy approach. And we just talked about fibroids and how we both approach that. And then next, I guess we're going to talk about probably similar stuff, but I like the fact that we're addressing them separately. Yes, somebody said, I had 4 surgeries within a year. They removed fibroids and I got adhesions apart from the endometriosis. Yes, surgery is just, unfortunately, we always hope, I'm sure there's plenty of surgeries that go really well for people. I don't want to knock surgery because I think there's a role for every treatment for every person, but it's just, you never know what's going to happen. And, you could be that small percentage of person who, in that small percentage of a person who ends up with a complication from surgery. So, of course, natural approaches are always, great to combine with all the other approaches out there.
And I have to say, I've worked many, many years as an orthopedic physical therapist, meaning if someone had knee pain, back pain, shoulder pain, they came see me, and also post-surgically. And it's standard of care that someone post-surgical would see a physical therapist. And it's so crazy to me that people have abdominal surgery and they don't see anyone. And usually what I end up seeing years later are adhesions of the body, because scar tissue is scar tissue, right? Once you cut into something, there's going to be a scar there. And so it's crazy to me that that is not technically the standard of care for abdominal surgeries, because scars and adhesions do form. And there are things that do happen as a secondary to having surgery in your abdomen. And we just don't, for whatever reason, address it the way we address it in orthopedics.
Yeah, totally. And I can say that happened to my mom too. My poor mom, she ended up having fibroids and then had surgery, and then she had adhesions and had surgery. It was just, and I felt so bad. It's like she thought she was done with one thing and went on to another thing. And it's tough. You know, again, I think she ended up with an ovarian cyst and then had to have another surgery. And again, root cause, right? We didn't address the root cause of her fibroids, which were probably high estrogen levels. Then she ended up having an ovarian cyst, again, high estrogen levels.
Exactly.
So we really didn't address that root cause, and she ended up with another surgery. So anyway, I love you, Mom. Thanks for letting me put your medical history out there. She's probably watching it.
Thank you, Mom. But
she knows that
amazing though that relationship wasn't seen, right? In the sense of like, oh, something happened to your body that was due to high estrogen, and something else happened to your body that's due to high estrogen. And
I wasn't doing integrative and functional medicine at the time, so I didn't make those connections. I've been doing this for I've been doing integrative and functional medicine for about 3 years formally, but have been doing integrative medicine since that time, because I saw so many things in women's health, including my mom, my friends, fertility issues for so many people, endo and so many people. So it really has kind of, prompted me to find out, hey, what are we doing here? We're not giving women good service when we're not figuring out really what's going on. So multi-pronged approach is really important. So hi, everybody. Thanks for joining. Oh my gosh, we have so many people joining us. I'm so excited. Thank you. This is great topics, I know, and it hits a lot of women. So we really, it's good that we're talking about this. So I think our last topic was painful periods. And so Janet, you tell me what's your approach for painful periods?
I mean, it's interesting because realistically, I can help definitely with painful periods, but I don't like sit there and be like, come see me and your period pain will go away. Ultimately, what I do is I do my assessment and I treat the things that I see that aren't working as well as it should. So usually what happens is people who do have painful periods, they have all these other symptoms that they're actually seeing me for, and their pain during their period gets better. And they're like, oh my gosh, like I've seen you for a couple of visits. I had my cycle. It wasn't painful anymore. Like I didn't have to take the, 5 Tylenols or whatever, right? And so what I usually do is actually assess. I do a lot of assessment in and around the uterus and the tailbone, because of the uterus's attachment to the tailbone. That gives me a little bit of insights on what is happening. And depending on where the person's pain is at, right? Because some people have a lot of low back pain during their period, and a lot of people have, different people, or even same people, have abdominal pain and cramping in the front side of their body. That might cue me into what needs to be addressed maybe first. But looking into all the ligaments that surround the uterus and seeing if we can restore balance in those ligaments. And so that the tension off the uterus is not as high, right? Because when you're on your cycle, on your period, things change about your uterus, and it starts pulling on these ligaments. And if there's already a lot of tension on them, it's going to cause a lot of either pelvic pain, lower abdominal pain, low back pain. Our body's not very good about, feeling organ pain, really. There's some that are easier to feel than others. So that's why sometimes with pelvic things, the pain is very diffuse, right? We don't know exactly what's causing it. And I think that's why we feel a lot of women feel lower abdominal pains during their period, because of this diffuse pain pattern, and it's coming in from these ligaments that are pulling on the pelvic floor.
I mean, and I think about all the women who used to come to me and they say, oh, I have a retroverted uterus, or have a,
I can feel that.
Yes, you can. We can feel it. I mean, in an exam, I can feel that they have a retroverted uterus. Even small things like that. I mean, even though I think we typically in OBGYN will say, oh, that's not a big deal. I know, because I have a retroverted uterus. I don't know if that's TMI, but I have back pain on my period, at my period.
We can help
specifically. I know, right?
Let me help you.
Go. I need to see you. There we go. I thought I didn't need to see you, Jen, but I guess I do, right? I'm just hoping my period goes away soon. That's what I'm hoping for.
To
But
me, the
exactly.
retrovertedness is that pulling of the ligaments,
Yes.
right? It's so taut in the back, right? Backside. So I'm not surprised you have
Yeah.
low back pain, right? During your period is because it's so taut in the back that it's pulling it retrally.
Right.
And by doing, I usually press down on the tailbone, see how the ligaments respond when I slowly let go, let it rebound. And actually, in a lot of women, what happens is the tailbone actually wiggles a little bit when I come back up instead of coming up in a nice smooth up and down. It just kind of does this, and you're just kind of slowly pressing and waiting for that wiggliness to go away. And I check actually for, I can see the retroverted uterus externally because the whole like front side dips, right? Like it's right bladder, uterus, like it falls off the cliff. And
totally.
so we check, and a lot of times the position is different, just different. So yeah,
that's awesome. And like, oh shoot, I forgot what I was going to ask you. Oh, anyway, that's cool. Like, I was just thinking, you know, just the painful period thing. You know, there's so many little things like the deferred pain. Oh, I remember what I was going to tell you. You were telling me when we talked, oh, you know, so many people get told to do Kegels.
Oh yeah.
And we really, you know, I love that. You know, I thought about that this weekend. I was like, Janet was telling me I had a pelvic pain. I went to a conference and I was listening to the speaker talk about pelvic pain, and I was just, it hit me when, because you had said that to me, and I've heard that before, but when you said it to me, it really hit me like, oh, we do need to relax, right? That's what you were saying, more than we need to tighten, and we keep telling people to tighten, and that's causing more problems, right?
Definitely. Not everybody needs to squeeze their pelvic floor, right? And I do see a lot of people who are fit, right? Who have a background in running, or they have done CrossFit or some type of strength exercise. And I usually tell those people, like, there's no way you're doing all this strengthening and only your pelvic floor muscles are weak, right? There's something else going on there. This might be a side note. Interestingly, I was at a workshop this weekend and was taught to do bucopharyngeal fascia mobility. And that has been amazing. I had this done to myself, and pelvic floor is completely like relaxed.
Wow.
So I do wonder how much, and of course, a lot of people I do see have high central nervous system tension, and that's one of the ways to help with central nervous system tension. But it just does it from the bottom side of the skull versus the top side of the skull.
Right. Wow. Yeah.
And so it's like not just muscles, right? It's like nerves and ligaments and fascial containers and spaces that we have to be considerate of.
Right. That's so cool. Yeah. And I mean, from my perspective, when people are coming for pelvic pain, I think definitely for pelvic pain, they're getting a referral to PT, because we're trying to figure out, is it really the reproductive, you know, from my perspective, I'm looking from painful periods. Is it deferred pain? Is there deferred pain? Painful periods, what's going on hormonally? And then pelvic pain in general, like if somebody's coming in for pain with sex, that's really like stuff that I would refer to you. But I'm also looking at the GI system, because from my perspective, painful periods is inflammation. Pelvic pain is inflammation. Is there any microbiome issues? And I think there's a lot of people who would, you know, don't talk about it. I asked the conference speaker this weekend, I was like, you know, there's a lot of data coming out on vaginal microbiome, uterine microbiome, gut microbiome, all that areas, they're all there. They're all in one place. So the microbiome is going from one place to the other. You know, we've got bladder people, bladder pain folks, you know, if there's any kind of painful periods, I'm wondering what else is going on in that system. What's going on with the microbiome? Are we seeing some underlying inflammation that we can improve? And is there systemic inflammation? Is that a clue into something happening systemically? You know, not just the physical part, the muscle, the fascia, all that stuff that you're looking at, but is there something else that I need to look at from my perspective, integrative functional medicine? And I think the gut is really tied with, and that was the other thing I was going to say, when you have painful periods and it's retroverted uterus, there's also an effect on your bowel function. So, you know, Is there something going on with the with IBS and
because it
irritable bowel syndrome?
pushes
Yeah.
back onto the
Yeah.
rectum, right? If it's pointed back, it's going to push on this guy. So, yeah.
Yep.
Just wanted to
So
give the visual there for the
it's
people.
awesome. I love that. I got to get my own
Yeah.
pelvis. I've got a little uterus.
Yeah.
I've got a little uterus around here, but I don't have a pelvis.
Yeah.
I got to get a pelvic bone.
They're great for models.
Totally, totally. And I think it's important for people to see what's happening.
Yeah.
They don't really understand what's happening in their body until they visualize it. And for women, it's really tough to explain to their partners what's going on, especially if you have if you have a male partner, if you're in a heterosexual relationship, your male partner really doesn't understand women's bodies. So when you have fibroids or endo or painful periods, they're not understanding why you have all these symptoms and what's happening down in that pelvic floor. And another thing I wanted to talk about before we head out was you and I were chatting about how so much trauma is held in the pelvis and the abdomen region for women. And we really hold trauma in those areas. Mm-hmm. And that is like, in my head, a root cause for a lot of these symptoms and issues is, are we having some trauma that we're holding on to in our body? And, there's a lot of books out there now about how trauma is impacting, our bodies. And specifically for women's health, I think we need to look at the pelvis as that.
And we have to clarify trauma, because we always think of like trauma as like some very physical trauma related to sex or something like that that's happened to you. However, it can be growing up, how your parents, your family viewed puberty and sexuality. Yeah. It can be related to maybe some embarrassing bowel and bladder thing at school, right? When you were little. It doesn't have to be this very,
No, like it could even be something minor.
Yeah.
It could be something minor. Yeah. Something that's traumatic to us in childhood can have a huge, you could, I was talking to a therapist about this 2 weeks ago, and she was saying, it's hard because sometimes people come from really good family backgrounds and, they've had what they would be labeled as having had the perfect childhood. And then I'm digging, they're digging deep, and that's when they realize there was this traumatic event that happened, or, whether they were bullied or whatever, and that is impacting their health. Yeah. So I think, when we look at the pelvis and we look at these conditions, I'm always like on the lookout for, what's really happened in the past, and is this, are we the potential for why there's affliction and disorders there, dysfunction. So we got a lot of, anybody have any questions out there? I see so many of you have joined, and I'm so happy you joined us. And if you have questions or would like more, maybe we do this again. I didn't think we'd get so many people. Sometimes I go to IG Live and I get 2 people, and sometimes I get 100. It's like, you never know, right? So
if anything, going back to you were mentioning Kegling and how that might, why too much pelvic floor strength can cause some of these symptoms. I wish I did have a split of the pelvic floor where it kind of splits open, but you can kind of see it where these are the muscles and the organs are on top. And so if you imagine these muscles are very, very tight, it does this, right? It cinches everything down. So essentially what's happening is it's displacing these downward towards the opening. And that's why people can have bladder, bowel, different incontinences and prolapses because your pelvic floor is too tight, right? Is because the musculature is below. When it tightens, it does this, right? Everything's shortened, but that's pulling things downward with it, right? Because of the organs attachments to the pelvic floor. So that's why, I think that we do have these disorders with a tight pelvic floor. Right. Something that's already kind of very stiff and rigid. It's pulling things down with it because it's so tight. Yeah.
Somebody questioned whether we address diet, and I know you do too. We both, talk about nutrition. I actually send people to a dietitian as well as part of my program. But, obviously, if we're looking at reducing inflammation, we really do look to the diet, and food is right? So we want to encourage all our clients to be eating healthy, and you know what eating healthy is for you is different for somebody else. So
And
you need an individualized approach what that is.
Exactly. I do. I don't recommend diets, but I do suggest to people, especially if they are, let's say, higher estrogen or something like that, like, hey, let's get more leafy green vegetables in your diet, because that has been known to help absorb extra estrogen and pull it out of your body, right? Or having berries, or having more. Let's kind of see what happens if we, you know, have more omega-3 fatty acids, right? Whether that's with fish, chia seeds, whatever, and less red meat, right?
Yes.
Because really looking at it, because I'm really trying to think about why we see such a prevalence of these various diagnoses now. Is it because it was so underdiagnosed before? Or is it because the diet has changed so much recently? Right? And how are our numbers in the United States different than different countries? That their diet looks a lot different.
It really is because of processed foods. I mean, we had an introduction of you and I were talking about that the other day, and women went into the workforce and got busy and weren't cooking as much and needed fast and
TV dinners.
Food. Yeah, and so we are eating processed foods, and you know that is and then we have this whole thing about fat is bad, which not all fat was bad. Actually, good healthy fats were good for us.
I think that was a turning point, right?
And that's where diabetes went. Yep, that was where
diabetes went. When we traded like eggs and, like, let's say hams for breakfast for cereal.
Yep.
Right. Yeah.
Yep. Exactly. So definitely diet is, you can't do what we're doing without addressing food as medicine. And I think, you know, definitely a chemical, physical, energetic approach, but that is all in food. Food is all about energy and how are we going to sustain our bodies and how are we going to heal them. So blueberries, berries, great antioxidants, leafy green vegetables, you know, great sources of all kinds of vitamins and minerals, you know,
cultural foods too. Having some of that during your day can help with the vaginal microbiome that you mentioned.
Exactly. Right. And then on top of that, like your cruciferous vegetables, which are great for balancing estrogens and hormones. So yeah, I mean, definitely. And I think all of us definitely love, and you know, we may end up doing like a multi-panel Zoom maybe at some point, because the dietitian I work with is wonderful at addressing all of that. She's here in San Jose as well. And then, you know, we have lots of colleagues who we rely on. I think if you have these conditions of, you know, I'm not the only person you should see. Janet isn't the only person you should see. You should have a team of people to help you so that you get the best of everything. And that's what we do. We refer to each other, refer to others who can join us. So I refer to the dietitian. I refer to, you know, I have other folks I refer to, Reiki healer, I have craniosacral, you know, there's so many people that I utilize in my practice to help people. Acupuncture. Yeah, exactly. So yay, we got 40 minutes of good information out there. I'm glad you all joined us. And so I'm located in Campbell, Lotus Integrative Health and Nursing. Of course, you're already on our Instagram, so you can see where we're at and reach out to me if you're looking at for an integrative and functional medicine approach. And then Janet can give her information.
Yeah, I'm in North San Jose. I'm right between the McKee and Various exits off 680. So I specialize in pelvic floor health. So if you do have any questions about endometriosis, fibroids, or painful periods and how pelvic floor PT can help you, definitely reach out to me.
Yay. Thanks, Jenna. I'm so glad we got this together so quickly. We got to do it again. Yeah. And reach out to us if you have any questions. You've got our Instagram handles there. You can make any comments if you have any suggestions on future Instagram lives. I was doing Instagram live, you know, kind of on Wednesdays, but I wasn't getting this much play. I don't know. Maybe we need to change to Monday. Monday lunchtime. It looks like everybody's hopped on. So, yeah, if you're interested in any other topics, then we are happy to provide that for you. We did a quick synopsis of 3 conditions, but we, of course, treat many, many
Yes.
things. So we can do another one if you're interested. All right.
All
Thanks,
right. Thank you
everybody.
so
Thanks for
much.
joining.
Bye.
Thanks. Thanks. See you later. Bye.